Good morning, everyone. So that's my second video about the rebooking. And I want to discuss with you one of the most common reasons why patients wouldn't book as well or rebook with you. And I'm assuming that everything aesthetically and, as we said before, the trust busters are all covered. Like practice look perfect, you look perfect, DA, you're all professional, and everything's working really well. You're a very nice and gentle dentist, but your patients are not booking back. So again, for credibility, my name is Khaled. I have been a dentist for 20 years. I run my own dental practice, Lakeside Dental Spa in Harvey Bay, Queensland, for the last 14 years. And I took it from team members of 3 to around 40 staff members, and took from 1 chair to 10 chairs. So one of the most common reasons patients are not booking because they are not concerned enough about the consequences of seeking treatment. So let me give you an example, and a lot of dentists are trained to do that at uni, reassure too much. So for example, a patient has perio or loss of attachments on their teeth, and they require some periodontal treatment, for example, on multiple sessions. So we can tell the patient, you got perio, there's other problems, we need to fix them, or you will lose your teeth, and so on. And patient says, oh, okay, when can I book? Look, let's get you in next week. Oh, maybe I'll think about it. I'll book back maybe in a few weeks. Maybe I'll wait for a month. And what dentists usually do? Yeah, that's fine. When you're ready, just let us know and we can book you in. So the patient is not concerned enough, and you're too casual about it as well. And you are disservicing your patient if you're not explaining them the consequence of not seeking treatment. Because simply, it's a chronic illness, but it could be just 1 or 2 days left until something will be triggered in their immune system, and they will end up losing a tooth or getting problems in their heart or something else that the perio will be contributing to it. So your role is to make sure the patient is concerned enough to seek treatment. So my patient should be understanding that there is a problem. If we don't fix it, there is a risk of losing teeth. This risk can happen anytime. Although it's been okay for the last 5 years, there's no pain. You haven't lost any teeth, but we don't know how long it will take until it gets triggered. It could be just, it's waiting for another week until you get to the end result where it's too late and the tooth has to be taken out. So if they say, oh, can it wait for a few weeks, I'll come back in a month? Sure, it can wait, but the risk is still there. There is a chance if we treat it this week, we might catch it before 4 or 5 weeks in advance. Patient has a crack on the tooth, for example, or a large filling with a small cavity on the side of it or something, and say, oh, can it wait for a few more weeks? I'll just come back in 5-6 weeks. Yeah, sure, it can wait, but between now and 5 weeks, high chance you could be bite on the wrong spot while you're having dinner, the whole tooth is split in half, we end up extracting the tooth instead of fixing it. So I'm not sure if you want to go through something like that or not. So you're doing a service to your patient by explaining to them the consequence of doing nothing, so they can seek treatment, so you can help them. Your intention is not just to get your appointment booked full. Your intention is not just to generate income from the patient. You have to be truly believing that you want to help this patient as soon as possible. And this problem can become a bigger problem if it's not caught early. Even chronic problems can become acute in a matter of a day or two. So by waiting for weeks and months, you're supporting them on waiting that long, there is a high chance they will be in a lot worse position. So the end message is, if patients are not concerned enough about the consequences of doing nothing, they are not going to seek treatment, and they are not going to rebook, and they probably might wait, and they might forget about it. They come back 5 months later or 4 months later with an emergency. So your role as a clinician is to raise enough concerns without creating panic. Because if you create panic, they might say, oh, just take the tooth out. So raise concerns and reassure after raising concerns by saying, luckily it's not too late, we can still fix it before it ends up being too late where we have to take the tooth out, for example. If you find the information helpful, make sure you like and share it with your friends and colleagues. Please subscribe to my channel so I can provide you with more content. Thank you so much, and that means a lot to me that you watch that.